2017 saw the most detrimental flu season ever recorded in Australia. As a result, more people were vaccinated in 2018, and this dramatically reduced the number of flu presentations, meaning much less pressure on our healthcare providers. There are a number of flu symptoms to look for. If you notice any of these symptoms developing, make sure that you don't go near younger children or the elderly. Rest, hydrate and visit your local GP if these symptoms persist. If a resident or patient in your facility presents with these symptoms, start the appropriate infection control immediately. The 5 moments of hand hygiene are an essential practice, even more so during infection control. Here's a reminder. 1. Before touching a patient. 2. Before cleaning or aseptic procedures. 3. After touching body fluids or exposure risk. 4. After touching a patient. And 5. After touching the patient's surroundings. There are 4 different infection control precautions to be aware of. 1. Non-contact precautions. This requires the standard 5 moments of hand hygiene. 2. Contact precautions requires gloves and gowns. 3. Droplet precautions require gown, gloves, goggles and surgical mask. 4. Airborne precautions require gown, gloves, goggles and duckbill mask. As well as being best practice, fitting your PPE in the correct order will reduce the risk of infection. The best donning procedure is to always start with washing your hands or using hand sanitizer, then putting on your mask, goggles, gown and gloves. The correct procedure for doffing is as follows. Firstly, you'll remove your gloves, followed by washing your hands or using hand sanitizer. Then you'll remove your goggles, then your gown, rolling it downward, and then finally your mask. Once all is removed, you will wash your hands or use hand sanitizer. Flu shots are free for these groups of people in Australia. Simply visit your local doctors or pharmacist for your free flu vaccination. Did you know you can't catch influenza from the flu vax? Some simple things you can do to help prevent the spread of the flu include: get the flu shot, sneeze into your elbow, clean your hands and stay at home if you're sick.